Hey everyone, it's a dose of Dr. Drew.
I'm wondering if something's right. Hey, Randy, come on in, guys. Let's see what's going on. We have a little different setup here today, so we're
Yeah, the music wasn't working.
so we're not happy Sunday, Dustin. We're just not technically. We're a little unsure of ourselves here. So for March, I don't have a lot to talk about today, so I'm interested in your guys' questions and what you're all interested in. We just thought we'd hop on here for a minute and chat it up. I had a very interesting conversation today with a listener whose wife is involved with the some of the COVID vaccine trials, and I got a bunch of information from them about how to sign up for the trials and where you can go for that. Why did I get a COVID test? Because I'm doing a production next week, and the way productions are set up, if you're actually going on a set somewhere, you have to take a COVID test 5 days before you go on the set. So that is why I have no symptoms. I don't think I have it, but who knows? I mean, I'd like to know if I'm an asymptomatic carrier, that's for sure. I have been, wow, 60 fish, Chris, that's crazy. I have been,
We saw the fish.
yeah, we saw a bunch here in Southern California. Ashley, do I think we're leveling out? I think we are leveling out, but we're sort of at a new, we're not certainly not coming down. So we are, if you look, go over that data in just a second.
Somebody saw your video on Instagram.
Um, George, you didn't have the long swab, you had the cheek swab or one of the shorter ones. I just know the nasal pharyngeal swabs to be very accurate, so I'm happy to take those. And I want to make sure I'm not an asymptomatic carrier before I go on that set. Budesonide, I don't trust that data, Chris. It really isn't data, it's just an observational sort of anecdote. And again, because 99% of COVID is, well, certainly 85% is not serious and 99% don't die, if you're seeing young people, particularly now, there's mostly young people getting it, and you do anything to them, it's going to look like it works because young people recover. What is pool testing? It's essentially like taking a group of people. Let's say there's 10 people in a classroom, testing all 10, running them in one giant run in the lab rather than each individually. And if anybody comes up positive, they shut down that particular pool, that region, whatever that is. Um, Short nose swab in both nostrils. Yeah. When should the average person get a COVID vaccine? Is there a risk reward ratio to consider? Mike, I think the average person should get the vaccine as soon as it is fully approved. I do expect that the Moderna vaccine is going to be shortened because it's going to be so effective with so little side effect that they're going to stop out of it in October, November. Frank, thoughts on the Moderna trial? I just signed up today to be on the Moderna trial. I found a local outlet at UCLA, but I couldn't. I signed up to be in the general pool, and then I sent an email out to UCLA to try to get in their particular outlet because I want to take this vaccine. I mean, I want to make the point. I want to make a couple points. One is I want to be a human subject and be a part of the progress. Number two, this technology is exceptional and it's going to have great results. And number three, I want people not to be afraid of the vaccine. I'm so confident of its efficacy and safety, I'm willing to take it before it goes through its full trials. Um, let's see. If you have antibodies, does it mean you won't get it again? That's a very that is a hmm, that is a really questionable. Let me answer that. We don't know. If you have antibodies, you're probably immune. Question is, how long are you immune, and how necessarily immune are you? You can get your antibodies tested for viral neutralizing properties to see if they can actually fight off another coronavirus, which makes it very, very likely that you'll have immunity, but it doesn't guarantee it. I talked to a woman just a couple of days ago who had clear-cut COVID, tested positive, then tested negative, and then got another COVID syndrome, separated by a couple of months. And people are beginning to think that there's a possibility of reinfection. We still don't know if possibly she essentially continued to produce virus, it just wasn't at a detectable level, or the test was wrong, and then had a second episode. That's always possible too. Uh, let's see. how long with the immunity with the vaccine? The trials are 2 years, and we'll see if how long that efficacy lasts. Because the coronaviruses are very stable, the spike proteins of which the vaccine is directed against, it may well be that it's a rather sustained reaction. But again, I don't know enough about that yet. That data isn't out yet. Jeremy, Dr. Zelenko's claims were published. They are looking good. A couple of countries have identified similar studies that they have looked at on the hydroxychloroquine. I can tell you for sure physicians are using lots of hydroxychloroquine. It appears to be to good effect. Again, the quercetin and zinc is the other thing you can do for yourself. So, what about natural killer cells? Yeah, Joy Deal, Moscovis. That's going to be a really interesting new technology, which is people are going to be looking at the T cells, not just the immunoglobulin response. The immunoglobulins, right, are just the antibodies that we direct against the virus. The T cells are what direct the B cells to create the immunoglobulins. And so they might be a better indicator of a ready pool to fight off the virus. Dr. Zelenko did put up a post this morning that things were going well for him. He has a sarcoma on his pulmonary valve. So the pulmonary valve is the main outflow from the heart, the right side of the heart into the lungs. He had a sarcoma in his pulmonary artery, and now that has gotten onto the valve, and so they probably have to do a valve replacement. I'm gonna bet. What do I think about Florida? I'll tell you in a minute. Mark, I don't know if we'll need the vaccines every year, whether they'll be incorporated into the flu vaccine or not, much like the H1N1 vaccine was incorporated into the flu. Lenore, although some attorneys are saying we don't have a right to turn down the vaccine, I think you do. I don't like the idea of the government mandating anything for us, but I'm hoping you'll educate yourself sufficiently to see that these vaccines are very, very safe. Did the T cell blood test give you idea? PD, I'm not quite sure what you're asking there. Hormone implant, ask my doctor, menopause is getting really tough. Susan, they want you to tell us about the hormone implants. I don't know if now's the time because we have this weird technical situation here.
It's not weird. I'm just getting the
Can you get on the mic in some way?
Not really.
You're right. That's why I'm saying it's weird. So, I'm a big fan of hormone replacement therapy for women in menopause. I think we do woefully little to properly assess women, particularly perimenopause and menopause. Each woman is very different in terms of their response to estrogen, progesterone, and testosterone, but the three need to be replaced, and to not do so subjects women to a lot of unpleasantness. The Women's Health Initiative turned out to be a faulty study, like many studies can be if they're so narrow in their focus, even though it was a big study. How are the vaccines safe if they are authored by Bill Gates? Amy, nothing to do with Bill Gates in the Moderna vaccine, actually, and it's actually a co-project with the CDC. I heard Dr. Fauci talking about it a couple of days ago. He's very excited about it. I know I've spoken to a researcher, and it looks very, very good. You can read the literature about how it works. It's all out there for everybody to see. How do you rationalize with a meth head? You cannot. They are delusional, right? They get very fixed in their thinking, and the way the drug affects people, you just don't even waste your time arguing with them. You have to get them off the drug and into treatment somehow. Amphetamines, stimulants, bad times. I mean, they really are bad. They're doing the amount of destruction being done by stimulants now is once this COVID thing is over, you're going to start to hear about that. How does COVID-19 attack people with multiple sclerosis? I would think the same as anyone else, except because you're neurologically, you can have some weaknesses that would only be more pronounced, and so the complications would be higher. Is it going to be an injection or nasal spray? It is going to be an injection. Okay, speak about Florida and California. Let me go do that right now. So California right now has leveled off in terms of its death rate. It looks like it's cresting in terms of new cases and hospitalization, but it is difficult to say that that will be sustained. People are getting weird in California about wearing masks, but at least we know the death rate has popped up. It has gone from essentially 70 to 100, and it's now slowly drifting down from 100 per day. The overall new cases is spiking around a top. The hospitalization also has leveled out for around 8,000. We'll see if that holds. In terms of Florida, let's talk about Florida very quickly here. Florida. All right, everybody kept asking about Florida. Florida, let me get to it. Okay, Florida, the yeah, it's not all that different than California in terms of the new case rate. It looks like it's cresting a bit, though it is very hard to tell. The death rate has looks worse in Florida. New deaths per day will look worse in Florida than in California, in the sense that there's still some positivity to the graph, having gone from under 50 now to over 100. We'll see if that crests or not. It's hard to draw conclusions from where this is. Let's see what for instance, hospitalizations went from 20,500 to 20,900 to 21,300. So it's still kind of picking up a little steam. The new cases went from 315 to 327,000 to 337,000 to 350,000. So that was today that it's picked up a little. In other words, it's not exactly slowing down, and let's see if it's from 254 to 269 to 282 to 291 to 301. Yeah, it may be picking up a little steam even, maybe still got a ways to go. So Florida needs to get on the distancing measures and do the things that we know work. It's pretty simple. How many of you guys saw the interview I did with Chad Kroger and his friend JT? I mean, to me, that was the best health messaging video that we've had so far during this pandemic. Um, uh, what I said from Mom's Out, the deaths from meth are on the rise. They are on the rise because, Jessica, because the use is so high, so extraordinary, and it's been prolonged, and people are really dying frequently from this drug now. And the causes of death are quite protean. They're quite often cardiac. What is he? What family are on meth and pills, have kids in the house? Oh boy, I would call social services. I mean, meth with kids in the house is really dangerous. Um, yeah, okay, Chris. Chris says, I've had 3 family members who've been tested, waited for 4 hours, got tired of waiting, and left. 3 days later, they were notified of a positive test. I've heard that test from 5 different sources. All 5 sources, I've reached out and said, please let me interview those people. I would happily interview them on TV, and magically they haven't stepped forward. So, Chris, please give me the email of those people. I would love to talk to them. I will talk to them on TV. I believe these stories to be apocryphal because so far I have not, I've heard the story 5 times from 10 different sources. Not one person has stepped forward to make contact with me to tell me the story that that's what has happened to them. So you're saying it's 3 family members. Give me the contact. I will happily put them on TV to tell that story. So it appears to be not nearly as big a deal as people said it was. Uh, a lot of false information on social media, Pollyanna, about what?
Did you see the question on LSD?
Yeah, I don't know what to do with that. Uh, Susan, I can't answer every question.
I understand.
The question was, could DMT have the same results? I have no idea. I have no
somebody
idea.
takes LSD for treating
I-
cluster headache.
And could DMT show the same results? That is Ben Dover's question. And for Ben Dover, his name is Ben Dover. I know of no evidence that LSD is it has efficacy. I know of no evidence that it has efficacy for headaches, and I've never seen it use DMT for headache either. Though those are not areas of research actively right now. How much can I bench, squat, deadlift? I've got a bad shoulder these days and bad back. I used to be able to lift a lot. Now I can't because of joint problems. Me salsa, I am still a Fauci uh, apologist. I think he has been spot on all the way. Of course, he has made miscalculations and said some inaccurate things, as every physician has done throughout this epidemic. He is no different. He was wrong on the masks, or at least maybe he was lying to us, whatever it was. And but he is he should be your source to get us through this thing in one piece. Mm. Leronlarab results for mild to moderate on Tuesday AM. Yes, Ben, we're gonna talk to somebody who has done some research on not just leronlarab, but some of these other monoclonal antibodies that are looking very, very good. I was just fishing around today. If you want to see all the clinical trials going on for the treatment of COVID and for the vaccines, go to clinicaltrials.gov. It's remarkable how many studies are going on. They even study Viagra for COVID, which I thought was astonishing to see that. Yeah, Sam, I'm worried that the same people that won't wear the mask will not get the vaccine. That would be seriously concerning. Uh, okay, some of your guys' questions I don't know quite what to do with. Um, how do we know, how about starting a running death toll for obesity-related deaths after COVID runs its course? People have data like that, and obesity is a independent risk factor in COVID too. So a lot of people with weight excess have been dying of COVID. CBD has been found to be an IL-6 inhibitor. Thoughts for treating COVID? Very interesting, Haley. That could be a possible use. That makes sense to me. That may even be, go to clinicaltrials.gov. You may find a study like that there. They're studying everything. They're trying to find any utility with anything that's already out there. So I wouldn't be surprised that study is underway. Me salsa, public figures don't get to be held account, don't have the privilege of holding people accountable for the slander against us. The courts see the whole interpreted all as, hey, if you choose to be a public figure, you choose just put yourself out there, people can say whatever they want about you, which is awful, particularly when you're professional. But that's what the world is we live in legally right now. I personally tried to, I initiated a suit against the New York Times for a hit piece they did on me. It's still outstanding. And it probably won't go anywhere because the press is completely recalcitrant now, completely, and hides behind a veil of self-righteousness. Does the COVID-19 have the same stay-at-home order of 14 days still? I don't know the question there. Um, I bought a device called a phone. I'm just trying to get you guys. Are they tracking vitamin D levels in effects of COVID? Yes, that is being tracked, and there is a correlation there for sure, which is why people are advocating taking vitamin D. So, am I safe working in a restaurant? Well, John, obviously that's a significant risk factor, so you protect yourself accordingly. I think as long as you wear the mask, wear the shield, wash your hands, I think you're in pretty good shape. I mean, I don't know if you heard, I think I mentioned this last week, that two hairstylists were cutting hair for a week with active COVID. They didn't find out that that's what they were sick with till the end of the week. During that time, they cut 139 people's hair and transmitted COVID wearing masks, hand washing, 0 times. Two people, 140 exposures, 0 transmission. Pretty good indication that A, salons take appropriate precautions, and B, that masks work. How much vitamin D? Talk to your doctor about it. Somewhere between 2 and 5,000 units, international units. I wish, Donna, there was something to improve memory. There are medications that sort of dial back memory issues if you have a certain diagnosis, but there's no magic supplements that affect memory. Think about it. If there were, we'd all be taking it. It would help our performance. Yeah, Kathy, I saw that infant testing positive in Texas. The headline to me seemed misleading. I don't know what that study actually was. Somebody's got to show me where that data came from. Well, just something about it didn't seem right to me, and I don't know what it even means. So that study, and magically you saw that headline, and then it went nowhere. Doesn't seem right to me. Remember, there are now testing centers in Florida showing 98% positive results. Again, did they go back and retest those infants? Why were they testing those infants in the first place? I mean, there's a million questions about that story that were not answered, and it disappeared. So, Lauren, I'm not quite sure what you're asking. I got the virus from work, and mask worked the first time, but not the second time. I don't know what that means. Is it safe to meet in person with clients without masks? Barb, indoors is how this thing transmits. So even if you're 6 feet away from someone, it's not just the distance, it's also the duration. And so I would be concerned about somebody with masks off sitting for an hour in a therapist session. I think that would be concerning. Yeah, I don't think that's the masks, or what, even masks, don't make it 100% if it's a sustained contact with somebody. It's why, most of the transmission that occurs in a single household. Somebody brings it in from somewhere and then everybody gets it. That's the primary means of transmission. Exposed 6 days ago to a positive COVID case. My results came back negative. Elizabeth, I would call that good. Not everybody gets it every time. It's just not the way it works. The flu test is a nasal swab as well. How is it different? Josette, it's not different at all. It's the exact same test. I had H1N1 and it was diagnosed with the nasal swab. I can tell you it was an ER doctor that did my swab in 2009, and it hurt a lot more than the nurse that did it yesterday. I was sick, but trust me, it hurt a lot more. She really jammed it in my ethmoid plate. Do I think the virus is man-made? People are debating this. There are some qualities of this virus that give it its high infectivity. That is something that is a bit of a fingerprint for people that manipulate viruses to give them more infectivity. But that doesn't mean it couldn't have happened in nature. It's just kind of concerning. Hi, Amy. Your 3-month-old has it. You're waiting for test results for you. Florida is getting bad. I went over Florida a few minutes ago and said I am concerned about the testing. The positive test does seem to be accelerating, though there's some plateauing in the death rate. The case rate seem to be going up still. Yes. All right. So Booty Full asked, do I recommend multiple tests due to the false positive, false negative rates? Very hard question to answer. The bigger question is, what do we do with time function? In other words, you get let's say the test is 100% accurate, which it is not. Let's say you get a test today and it's negative. A week later, you've had different exposures. I mean, you have to keep getting the test in order for it to even mean anything. And you're also right that there not only is there false negative and false positive. Uh-oh, something happened to my head. What'd you do?
That was you? Oh, sorry.
Yeah. Something happened to my false, and not only is it a high degree of false negative, false positive, but just because you have COVID doesn't mean you're going to remain positive the whole time. Some people are sort of irregular in terms of their viral production, so it's kind of difficult.
Don't respond to every ping.
It sounded like it disconnected me.
I was.
Downturn in COVID deaths. Ivan, this is Alex Berenson's thing, is that there are areas that there are downturns in the death rate in spite of upturns there are downturns in the hospitalization and death rate in spite of there being more cases, and he's just making the point that that's not being reported. That's all. No, Jeans, the sneaky Guatemalan. I'll answer any questions you want here. Do I thoughts on the Neuralink? Yeah, Ben, bend over. Here's the thing about Musk and Neuralink that I think is problematic. If you open your skull for anything, whether it's a need for a surgery or a blood clot or something else, it has a tendency to change your personality. So Elon Musk is talking about putting in an electronic device that we communicate, that we sort of connect with, to have a direct connection to enhance our intellect. That is not a benign procedure. Even though it sounds benign, it is not. It is massively complicated in terms of what it might do to people. So the idea is great. The reality in biological systems is not going to, it's going to be a problem. I'll predict that. Yeah. Yeah. Just you making a little hole in the skull, your brain changes. And now sometimes we only do that in medicine because we have to, because the risk of not doing it is too great. Yes, Steve ATL, I understand that artificially manipulated chimera. I understand about that. That's what I was referring to. Whoa, you guys are moving quickly now. Are they seeing this thread also as I talk to them? Okay, so you guys see the questions as they come up. Stephanie, I hope Joe Rogan invites me in too. I would love to do that. Yes, of course, Juicy Cat. Everyone has heard about the blood clotting, because part of the inflammatory activation of the COVID cytokine storm includes blood clotting in the small arteries, but it can also hit the larger vessels as well, particularly people in any kind of pre-existing inflammatory condition in their endothelium. So again, weight in the midsection is a risk factor for that. Hypertension, hypercholesterolemia, insulin resistance, antiphospholipid syndrome. These are the things that put you at great risk for the complications. And then when you get the complications, clotting, and clotting that doesn't respond very well to anticoagulants is part of the deal. Yeah, Felix the cat. That's interesting observation there.
Felix the cat,
Uh,
my favorite. Oh my God.
are you radio?
So you have Rami of Gender coming on
I,
Tuesday.
we have who?
Dr. Oi.
Do you have Dr. Yo coming in?
Ram Agenda.
Yes, we're going to talk about on Tuesday. Talk a little bit about the monoclonal antibody targets that are out there, and some of the leronlimab and things like that. They're looking really good. In fact, Tuesday there will be some major announcements about some of these drugs, and he will talk about. Oh, Andy Oshkashvili wants us to get Dr. Oz in here. I think we should work on that. I think it's easier than you think. I think he'd
I
come
know.
in.
I
Yeah.
think we need to do an Ask Dr.
Okay. Oh, of course. Yeah, sure.
In August, once we get a sponsor.
Okay. So Andy, can you hear? Can they hear you? Can you hear Susan when she talks? Nicotine is tough, Steve. It's true. She said in August we're going to get Dr. Oz in here, and we'll do it with phone calls so you can come on in and be a part of the conversation. Is one positive that eventually, whoa, where'd you go? Type A blood type, more at risk. It doesn't matter if you're A positive or A negative, it's just the A blood type associated with the 6 genetic substrains that seem to have more problems with getting infected and having complications from this. Okay, let me try to scroll up. You guys
I
kind
don't
of.
know why the music didn't play at the beginning.
Is one positive that eventually more people will have a yearly flu vaccine? Well, I hope one positive is that people will start to pay attention to viral illnesses and not blow them off, like the flu, and understand that influenza kills tens of thousands of people every year, and you should take your damn flu vaccine. I've taken it for decades. There are just not enough vaccines in the world for me and my family because everything we can prevent that meets criteria of a phase 3 and phase 4 clinical trial, I'm in. Quick question. I've noticed some people just have the face shields. Wouldn't you think that'd be a good alternative to the masks? Angelus Mongols? You guys' names are too much. The face shield worry me because, again, the idea is to keep the water droplets close to your face. And the face shield still allows for it to come out underneath. So while it protects your eyes, for instance, when doctors work in the ICU where we wear a mask and a face shield, because you need your eyes protected and your mouth and nose protected when there's a large amount of aerosolized virus around. And remember, doctors don't get this virus very often, so we manage to protect ourselves and the nurses by wearing the mask. Do you think the masks don't work? How come they work in the ICU? Magical. Can I get COVID from contact with the person giving the test? MS Hannah,
Oh, yeah.
Miss Hannah, teacher. Yes, you can, which is why when the people show up to do your testing, they'll be in full PPE gear. That is to protect you as well as them. Thank you, Morgan. The quick acting test I worry about, Bill. I don't know the data on them, but I don't believe they. I think your best test is the nasal swab PCR. How long does immunity last? We don't know. That's what I was talking about earlier. Do I think we'll be able to vaccine by winter? I do. Again, having now looked around a little bit about the vaccine and talked to researchers, I think we will be seeing the phase 3 trial stopped midstream because it's so good, so effective with no side effects, in which case they will start giving it to frontline people and at risk people, and then by winter, everybody else. Todd, nicotine is a tough one to stop. It's I will just tell you, it's the same thing as all the other things you were addicted to. Nicotine patches, nicotine gum, and way more than you think you need under doctor supervision, hopefully. And there are medications out there that about 30% of the time really help as well. Did my COVID test hurt? No, it hurt when they did it to me in 2009 for H1N1. It just sort of really tickled this time more than anything. It was uncomfortable. I mean, it wasn't so. All right. Salsa, I don't justify Trump's behavior regarding masks. I wish he would come out strongly in favor of the mask. And the fact that And the fact that during the Oklahoma rally there were no masks worn, that was deeply problematic for me. Every time I am concerned, I am very concerned whenever you see gatherings of people, indoors or outdoors, by the tens of thousands not wearing masks universally. That is you're watching transmission if you're using pictures of that. And that's how we got into this mess, right? I mean, now we have upticks everywhere, and we need to get it back under control. We need to, make sure we wear our masks and keep our distance, that kind of stuff. Uh, what is the biggest issue that would come up that the vaccine is rushed? Bootyful, some unknown effect. I mean, they're going to be testing tens and tens of thousands of people on this phase 3 trial that's starting up any day. And if in 4 months you're not seeing any real you don't see any problems, it's unlikely to have any long problems down the line. But it's a new technology, maybe years down the line, some untoward effect.
We got a super chat. Flipping coin.
Thank you, Flipping Coins. We appreciate it.
Best supplement for sleep.
My best supplement for sleep is, well, it's a couple things. Benadryl works if you're, for everybody essentially, but it's sort of long acting, and some people get a hangover in the morning. The other problem with Benadryl is it causes tachyphylaxis. In other words, it wears off with time, so you have to stop it for a week and then go back on it. Melatonin is really kind of nefarious. It works amazing. The melatonin works better for me falling asleep than any sleeping medication I've ever taken. But it only lasts about 4 hours, and if I take it again during the middle of the night, I have a little bit of hangover during the day. So melatonin and Benadryl, those are my sort of two favorites. Um, Andrew, what about long-term effects? We don't know for sure. That's one of the things people are concerned about, but I think well worth the risk. Think about the long-term effects that people are starting to talk about now of COVID, all the neurological effects, the psychiatric effects, the pulmonary effects. So people are now starting to be concerned about the more lengthy long-term effects. Is vaping better than smoking? Yes, in all regards. In all regards, for sure. Is it better than not smoking anything? No, but it's better than smoking tobacco. Vaping is better than tobacco. Bootyful, I have not heard from Artie lately. Is something going on? Uh, Jennifer, if you have a high-risk family member, would you be comfortable sending kids to school? I'm not quite sure what you mean by the connection between those two things, but I would be comfortable sending people to school once they put the proper, distancing and stuff like that in place. I think keeping kids back from school is going to might have profound effects that we don't even fully know yet. And the American Academy of Pediatrics has consistently raised concerns about this. Tony G, I don't know about the quercetin long term. I don't think I would take it long term.
Thank you for super chat.
Thank you for the super chat. So we appreciate that, Steve Atlanta.
YouTube.com.
Appreciate it. It's on YouTube.com.
/.
Is depression due to isolation from quarantine and continued lockdown a major factor in the decline of immune system to combat the virus? No, it is not. Circ 500. It is a major source of substance use, alcoholism, and suicide, which is a much bigger issue than any modest effect on immunity. How do I feel about our healthcare being able to handle this virus? Like I said, if this had been if I'm convinced that if, say, Barack Obama were still president, this is not that different than it's different. It's not fair to compare epidemics, but H1N1 killed 575,000 people, infected somewhere between a half a billion and a billion people. It killed 575,000 20 to 40-year-olds, and you don't even know it happened. So all I was saying was back then, Barack Obama and his administration allowed the medical system to do their thing, and it was like a third story on the news at night, and that was it. I think we might have been better off if we just listened to the CDC and not had major lockdowns that not clearly were indicated, not clearly do anything, might have actually made things worse, certainly made things economically worse, and from a mental health standpoint worse. Yes, I think letting the medical professionals handle it and following their input, following Dr. Fauci, as I said at the beginning, I think we would probably be in a better place. I think we probably would be a better place. And of course, this is not the same as H1N1, and that is It is somewhat more deadly, and particularly in risk populations, and it is definitely more infectious. Um, is the news responsible for H1N1 not being crazy during the Obama administration? I don't. That's what I was complaining about back at the beginning of this thing. Was I wanted the press to shut up and let the medical and the mental health and the county mental health system, not mental health, county health systems handle these things. What's that, Susan?
Far more politicized.
Well, everything's politicized, it seems like, and it's bizarre. It's very distressing when medicine loses control of the science. When people who've never heard the word hydroxychloroquine already suddenly feel entitled to having an opinion about whether it works or not. That's a clinical question. Same thing on any of these issues. That's why I kept saying, listen to Dr. Fauci. He's an expert in outbreaks like this, and he will get us through this.
Sneaker hijack, super chat.
Thank you, Sneaker Hijack. Your kids are depressed, Paul. I know. I'm very concerned about 8 to 15-year-olds. I think some of them we may have had the lockdown and the cancellation of school may have effects on some of these kids that they may never get over. I mean, this is really serious stuff. It's like I can't say it strongly enough. So yes, I wish the medical system had because the medical system is used to making risk reward analysis. It's used to saying, okay, we're going to lock everything down now, but let's prepare for all the untoward effects that will have. Suppose the government just goes, "Hey, man, we're closing it down. One life is too many. We're going to close it down." It's like, no, you're going to cause death elsewhere. And by the way, we're seeing right now the main reason hospitals are full is not COVID. It's that people have been delaying coming to the hospital, and now they're pouring in with more serious illness that they should have had dealt with 2 and 3 months ago.
So Sneaker Hijack said, "Hey, Dr. Drew, big fan. Loveline was the best show. When I got chlamydia, I knew what to do to get tested."
Great Sneaker Hijack. I'm glad when you had chlamydia, you knew what to do because of Loveline. Thank you for that.
I had to read it because he paid you $5.
Look, Sam Walton, I cannot say, you're not giving me any information about a dermatological problem. That tells me nothing. Tells me nothing. I would actually have to see it to know if it's anything to be concerned with. There are all kinds of we all have dark spots on our skin. Yeah.
Artie Lang was maybe in course right again.
Oh no, is Artie in jail again? Oh boy. Okay. So
Would you consider working with him in the future?
with Artie, I mean helping him. I would try. Artie's a friend. I would help Artie if he reached out. When is the vaccine coming out for the world, not just the U.S.? RN less? I believe it will very quickly on the heels after the U.S. I'd say, like wintertime, I suspect. Um, did I hear about the Kentucky couple placed under house arrest for refusing to sign self-quarantine contracts after testing positive? They should have signed the self-quarantine contract. When I read that article, that's just what I thought. I mean, just sign the quarantine contracts. Come on now. Was there ever a time I felt the need to publicly distance myself from Adam's statements or behaviors? Yes, there have been times, and I would yeah, Christopher, try the TheraWorks. It really is an amazing. Before I answer your question about Adam, so Christopher, TheraWorks works for leg cramps really, really, really well, and the medicines you have to take to control it. This is why I got involved with TheraWorks. Is medicines to treat leg cramps are dangerous. And this is a lotion that really does work. Give it a try. I've had really good results with it.
Bootyful is my favorite person today.
Bootyful?
She has a super chat.
We appreciate Bootyful.
Thank you, Dr. Drew. You provided much needed calm and real information.
Can you guys hear Susan? Tell me yes or no. She's talking to you all. I don't know if she's saying. I did?
No, they can't hear me if you're talking. Anyway, so she says, I look forward to your live streams. Thank you.
Thank you.
Bootyful.
Hi, thanks, Bootyful. Okay, are hospitals returning people with illnesses away that didn't present as COVID? Yes, that's true. That was happening, and that's paying a giant price now. Also, an AV original something said you love David Allen Greer. So do I, and the fact that he's sort of okay, good. Thank you guys for saying you can hear Susan. That he has shut himself off to us is really distressing to me. It's like any other friend you had who suddenly turns against you for reasons you don't understand. But maybe it's what we were just talking about, which was some of Adam's stuff. And there had been times with Adam that I feel like, look, I think you're all learning now that most people have blind spots, that they don't see other people's points of view from the experience of their life. And Adam is no different than me. I have the same problem, and I always try to shrink those blind spots as much as I can. But nobody can get rid of them completely. I will tell you my. Uh, hang on a second. I'm just. Did you see Andy's comment? It's
No.
really funny. um, that's so funny. How do I feel about the Gardasil vaccine? Alicia, as soon as the pediatrician told me I could give it to my daughter, I gave it to her, and as soon as it got approved for my sons, I gave it to them.
No, you gave it to him the same time.
No, because the clearance for the mail came a couple years later.
For all three of them at the same time, no matter what. Pediatrician let us.
Paulina had it when she was 9, and the boys had it when they were about 14, because that's when it got approved. And I gave it immediately to them all. The pediatrician gave Paulina hers, and I gave the boys theirs. That's one of the great. That is Gardasil prevents cancer. Why would you prevent head and neck cancer, anal cancer, penile cancer, and cervical cancer? Why you wouldn't take a vaccine that prevents cancer, which has one of the best safety profiles of any vaccine in history. And most countries require it because they don't want to be treating those. I did the boys. I did it. I did it in the kitchen. Yep. What if the vaccine doesn't give long-term immunity? It's possible that we'll have to retake the vaccine. That is possibly true. Vaccine caused cancer? None that I've ever seen any evidence of, so I'd like to see that data. Gardasil does not last forever. Yeah, but whether it needs to be redone or not, that's an interesting question. Is meningitis considered a virus? No, it's a bacteria. Well, there is a viral meningitis, but the ones we are worried about is meningitis B, which is a bacterial, and there are vaccines for some bacteria. So let me go back to Adam's thing and the blind spots. So occasionally he'll have a blind spot, and I have to and he doesn't take well to calling out on those things, so I will just sort of be shut up. Um, Chica. Gardasil isn't allowed. It's not that it's not allowed above a certain age. The FDA, look, drug companies do the studies to apply to the FDA for very specific intervals of age to give vaccines. The Gardasil was approved from age 9 to age like I think 40 now. And it doesn't mean you can't give it older than that. You can give it. It's just not FDA approved. They don't do the studies because it costs too much money. They're not going to sell that much vaccine to older populations. So they just do it for the population for which they're going to be selling the vaccines. Doctors are, when we use things off label, not FDA approved, we're out there a little bit legally, but if we document what we're doing and what our reasoning is, we're usually at our liberty to use things that are not FDA approved. So even though, the Gardasil only maybe goes to 28 now or 36 or something, we can use it at any point in the lifespan if we want to. Yes, that is the HPV vaccine we were talking about. So how is Tom Sizemore doing? I've not had any contact from him in a while. There's a vaccine court for people who are harmed vaccines. There is a vaccine fund for people that are harmed by vaccines. And again, the potential, and again, even if it's not clear that it's from the vaccine, but it's just possibly from the vaccine, they will still get those funds. And again, it's about 1 per million. You're more likely to win the lottery than get an adverse effect from a vaccine. Thank you, Sneaker Hijack. Can you tell how I feel about other celebrities and media members that have attacked you for my opinion on COVID? Does it bother you? Sure, it bothered me, particularly some of them were my friends, and it wasn't clear what they were even attacking me about. People were just looking for people to attack for I don't even know what reasons. I mean, it was a deeply distressing time. I would like any of those that were my friends to please explain to me what they were up to and why they felt. Well, I don't understand. Again, what I said was when there were no cases of the virus in this country, I said, don't worry, you're more likely to be hit by an asteroid than get this thing right now, which was true. I said the H1N1 killed 600,000 people and infected 1 billion. Remember that as you worry about this thing. And then I got some stuff wrong. I got some things wrong about the degree of infectivity and the intensity of this virus for at-risk population. I got that wrong, and I apologize for that. I will get lots of things wrong. It's impossible in medicine to get everything right. In fact, there was just an article in the New York Times today about uh, by Maureen Dowd talking about how yes, physicians are trained to immediately adjust course when they've made a mistake, to apologize for it, learn from it, and keep going. That's what we do all the time. Yes, GSR, I was advocating for the HPV vaccine way, way early, and then people were somehow against it for reasons that was very unclear. Uh, make the rebuttal video. Skullcracker thinks I should make a rebuttal video to put it to bed. Yeah, we've thought about it. This thing is a moving target. Nobody got everything right the whole way through on this. Here's somebody saying photo techniques about Dr. Fauci lying to the public. He got the mask story wrong. He was looking at that old data. He was speaking the truth. He was also trying to protect personal protective gear for the people in the front lines, and it was an appropriate thing for him to say. He then adjusted course, which is what we do in medicine. Do I think this will reach as many infections as the Spanish flu? No. In fact, Dr. Fauci was just on the record with that last week saying it will be nowhere near as bad as the Spanish flu.
I have a shout out for calling out Monday 6 p.m.
Okay, Susan Pinsky has a new show called Calling Out on Tuesday at 6 p.m. Monday at 6 p.m. So check her out there. She has a group of psychics that join her, and Colby Rebel this time. Okay, if someone consistently has low normal neutrophils and lymphocytes, does it mean they have a weaker immune system? Not necessarily. Not necessarily. Though low lymphocytes when you're infected is a bad sign of complications of COVID. So let me tell you, sneaker hijack again. Being a guy who truly cares and gives us hope. Thank you. I appreciate that. Thank you, Sneaker Chat. You should do Loveline on MTV again, just my opinion. Sneaker Hijack, we've talked many times over the years about bringing back Loveline, bringing back Celebrity Rehab, and it never really goes anywhere. So you'd have to tell MTV and VH1. Maybe they'd be interested in hearing from their viewers. So let me go back to the blind spot thing. I didn't finish that study. So for me, a great piece of evidence of one of my blind spots was I was reading Frederick Douglass's biography. Of course, Frederick Douglass is the great former slave orator, anti-abolitionist who his life was just unbelievable. And some of the things that man said ring very, very true to this day. And so he was asked to speak at the consecration of it was essentially the Emancipation statue, which recently had come under attack and people wanted to tear it down. And the first person to attack it was Frederick Douglass. And if you look at it through the eyes of Frederick Douglass, you will see that it's a very demeaning statue. And he said, Abraham Lincoln was a great guy, and they became good friends. Abraham Lincoln was a racist, which he was, and he changed his racist attitudes. But Frederick Douglass went on publicly in this consecration, said, but he was not my president. He did not represent black people. He was a white president, and he sort of implied that he was a white supremacist. And I thought, it just startled me. It shocked me to read that, and the scales just fell from my eyes. And I thought, oh, he's right. Abraham Lincoln was a great leader, but he was always looking from the white perspective. And his job, as he saw it, was to preserve the Union, not to save Black America. And that was his perspective. It was a white perspective. And I thought, oh my God, that is just a stunning thing for me as someone who's read an awful lot about Abraham Lincoln and his policies and beliefs and things. And so I would recommend you all look at Frederick Douglass's biography, the most recent biography, if you can. Okay. Moving target, how can you be sure to mutate into something like the Spanish flu? Charles, it does mutate, but it doesn't seem to be it doesn't seem to be causing, it causes a little more infectivity, but not more serious illness. The only good thing about coronaviruses is that they're relatively stable viruses. They don't change a lot. They don't mutate a lot. Chris, thank you for confirming what I said about Abraham Lincoln. Uh, A man is 60 experiencing alcoholism and experiencing minor forms of jaundice. Any program you'd recommend? Morgan, that's you? Yeah. You need to stop drinking immediately, but you're going to need medical management to do so. I would go to a 12-step meeting or Zoom into a 12-step meeting right now. Go online, go to aa.com, Zoom in a 12-step meeting and say, I'm in trouble, I need help. And see if you can get in touch with some people locally near you and find people that do good work with that. How do I find time to read all these books and watch Love Boat? Love Boat, Susan, how do I find time to read books and watch Love Boat? Love Boat actually is a low priority. But but I've been reading books and listening to podcasts or tapes and lectures and things most of my adult life. I was very fortunate to have a really high quality liberal arts education, and that just launches you into never stopping learning. Lisa, you're a triplet. Congratulations. They're all good. I know a lot about buprenorphine, Marissa. If you have any questions, I'm happy to answer. I have my X certification to be able to prescribe that if I need to. Who is the author of the Frederick Douglass book? Give me a second and I will look it up for you because it's a new one. Okay, it is by, come on. I'm gonna have to go on Amazon. Give me a second here. All right, the author is, it's a very good book. I love this biography. Oh no, it just screwed up. I don't know, whatever I clicked in there did not take. Can you do it for me? Go on Amazon and look up Frederick Douglass. There it is with the two S's at the end of his name. And it is by David W. Blight. David Blight is the name of the author. Blight, B-L-I-G-H-T.
Let's mention this week's show on After Dark with
Tom Segura is on with me right now. So not on After Dark. Go to Dr. After Dark. Tom Segura is there. Can a 40-year-old ask his doctor about getting hormone replacement therapy? Corban, I assume you're a female, I assume. Yes, absolutely. As I said earlier, perimenopause is something that is not nearly actively enough dealt with. Will I discuss blind spot with Adam on my Adam and Drew podcast? I have tried to discuss it with him. He's not exactly enthusiastic about that idea because remember he's very confident in what he believes. He feels he has a crystal brain and he has a way of thinking and seeing things that's very, very good and clear. And the rest of us, because emotions get involved with the rest of us, and he has a certain clarity in thought that I don't want to get in the way of. But he has the same blind spots we all have. Is Nadav missing? No, Nadav is back, I hear. Jazen, yes, Flovent. Any inhaled steroid can have systemic effects. It can. It sure can.
When was Nadav missing?
He was sick.
Oh.
Nadav was sick.
Did he get COVID?
He did not get COVID. He is fine.
I was in their studio.
Adam seems racist, Jeremy. I would say he is not. He has blind spots. He is not racist. And he is harsh. And so it makes it kind of seem that way. I mean, I don't see how, it does not seem, I would not call him racist. Is it okay to take vitamin C, zinc? Quinine, I don't know about. But quercetin, zinc, yes. Vitamin C, vitamin D, yes. 500,000 deaths due to influenza worldwide. Yes, Dustin, the COVID has just surpassed the influenza deaths worldwide. That seems to be true. And it will be worse than influenza. But this is the point. I just wanted people to measure their panic relative to other illnesses that are out there. This one requires us, look, this could get exponential and get out of control, which is why we have to wear our mask and be careful. Chest pain from the Advair, I wouldn't worry about that too much. I did not talk about Elvis's grandson's suicide. I don't know much about that. Prolapsed bladder and hysterectomy coming via robot on August 4th. Scared to take, well, if you're BRCA negative and you don't have first degree relatives with breast cancer, I think hormone replacement therapy should be something you should consider with your doctor. Okay. We need to lean on our history. We seem not to do that these days. Not only lean on our history, we need to learn our history. No one seems to be learning it at all. Can severe prolonged benzo withdrawal weaken your immune system permanently? I mean, it's not good for your immune system, but it's more what happens to your brain that from the prolonged and your psyche from the prolonged benzo withdrawal, which can be awful. Look at Jordan Peterson's Tale of Woe. Okay, how long have you been doing this, Susan? Marissa, you cannot swallow or eat food, tiny sips, and projectile vomiting. You need to see a gastroenterologist immediately. Immediately. Do not wait. Don't worry about COVID. Do not worry about COVID. If you're unable to swallow, there's something with the esophagus that needs immediate evaluation. Oh, really? R. Bryant is saying AstraZeneca's vaccine. That is the other really good vaccine out there. I think that's being done mostly in Europe, isn't it? So yes, and that is a standard vaccine. That is not an RNA vaccine. So that's sort of a more old-fashioned vaccines, and it could, and it could surpass the expectations from the Moderna vaccine. It's possible. All right, thank you guys for coming in. Thank you for our super chats. We really appreciate you guys being here. Let's see. Somebody says I have SLE, ITP-RA, partial epileptic, Keppra. Okay, good. I feel useless. Yawning and napping. Keppra can make you tired, but you should get used to it. You may want to reduce the dose of Keppra, perhaps. I don't know John Campbell. I will look around on that. Again, watch Alex Berenson. Alex Berenson is a very smart New York Times reporter who's sort of interpreting the data for you in a sane way rather than through the prism of panic, which is the only thing the press does now. It's the only thing they do. Okay, thank you guys for being here. We're going to wrap this up. We will be back again on Tuesday. Is that correct?
Yes.
Yeah, we're going to skip tomorrow. Andrew's wife is now standing in for Andy Ashkazvili. Thank you for that. I mean,
Is he gonna come?
oh, Nicholas, you're going to medical school? Enjoy it. It's a lot of fun. Particularly the first couple of years is a lot of fun. And then once you hit the wars in the third year until you're done with your residency, nobody's going to ever see, no one will see you for about 7 or 8 years. Goodbye. And that's just the way it goes. You have to dedicate your life to that training.
Andrew's reading is I'm Calling Out with Susan Pinsky. Let me get better.
Andrew's reading?
Yeah, I wanted to call in.
Oh, Andrew Ashkazvili?
Because he's been booking for me. I think it's time.
Oh, Andrew, maybe his wife will call for a reading because she's the one sitting there now typing for him.
Yes.
Can 8 years of Subutex mess you up forever? No, it does not. Get to as low a dose you possibly can, particularly if you can get below 2 milligrams. But if you're at 2 milligrams or below and you're able to maintain your sobriety that way and you're active in a program, don't change anything. That medicine is designed for long-term use. My concern is that people stay on high doses and they're using other things along the way, and it's a catastrophe, and they're not really even treated. So make sure you are treated. Buprenorphine is for withdrawal and not pain, Marissa. It's now being used as a very effective chronic pain medication. It's actually revolutionizing the treatment of chronic pain. It looks very, very promising. Adam's not cooperative. I'm not sure what you mean by that. 32 milligrams a day, Jazen, is a lot. You might want to get that down if you can. Again, talk to your doctor about that. I don't know your case. Hobbies are my work. Did Susan and I marry before or after residency? It was after residency, but we got together before. Kristen, I'm glad we helped you out at Las Encinas. Thank you for that. I don't know what's going on with Britney Spears. Anybody want to tell me about that? What's going on with Britney Spears? Do you know? No. She what? Yeah, I know, Bonnie. Bonnie says this is a really good, I would say this is an excellent criticism. You ready, Susan?
What?
Bonnie Wood says, you remind me of my drunk Uncle Butch at a wedding. He says goodbye like 8 times. So that's what I call good feedback. I would say it's good feedback. And so I appreciate the comment. All right, let's wrap it up then. And yes, CJ, buprenorphine way better than methadone. We're gonna wrap it up. Be back on Tuesday.
Wait,
And
don't do it so fast. Come on.
all right, she's saying don't do it.
Okay.
Methadone can look. These are all tools, guys. The methadone, the buprenorphine, and some things work for the trick for my profession is making sure we select the right person for the right patient in the right dose for the right duration. That's our responsibility. And if we do anything other than selecting that exactly right, we are doing you a disservice. That's the concern I have.
Yeah.
All right, guys, we will talk to you on Tuesday. No music.
No music today.
Dr. Fauci, can they hear me?
Nope. Oh, yeah, they might. Go ahead.
Dr. Fauci never recommended lockdown.
All right, there's no outro music, but I'm gonna hit you with all these banners really quick.
There we go. Are they still hearing us?
Yeah.
Well, I'm still. Yep.